In this video, I'm going to describe a very real situation that can cost many retirees up to $14,000 in additional Medicare premiums. And more importantly, I'm going to show you exactly how to avoid it. Coming up next on Holy Schmidt.
Holy Schmidt!
If you're new to the channel, hi, my name is Geoff. I'm a CPA turned author turned public speaker. I'm also the creator of the course Social Security Simplified. I started this channel in 2020, really at the request of my daughter. She saw me helping family members with their finances, and she said, "Dad, there are a lot of people in the world that are hurting right now. If you can help them, can't you help others as well?" And with that, the channel was born. Today, we have over 375,000 subscribers, over 50 million views, over 425 videos, and we would love it if you became part of our YouTube family. Simply click subscribe and turn on notifications, and you'll get alerted the next time I post a video. I post 2 or 3 times a week. Here's a fact that most people don't realize and actively disagree with me about on this channel. Most retirees will eventually sell their home. Now, after saying something like this, I almost always get a comment that says, "I have no intention of selling my home. My home is my security blanket. And if I sell my home, I have no security." Some do it early. They sell their home and they ride off into the sunset to that place that they always wanted to live but couldn't find the time to move to. Life got in the way, and now the responsibilities keeping them where they were are no longer there. Some simply downsize because they don't want to pay for the taxes and the upkeep of a large home for 2 people. Others do it because it's too much work and they don't want the hassle, so they move into an independent living community. But eventually, most people sell their home, and this creates a problem. There's this weird, almost counterintuitive fact when you eventually do make the move, and that is the longer you own your home, the more profit you make when you sell your home. Now, that's not always the case. Sometimes the economy is in a bad situation, as we saw in 2010, 2011. Other times, regions just aren't doing very well. But sometimes, in fact, most of the time, if you've held your home for a long time, it's going to be worth more than when you purchased it. And this creates a huge Medicare problem for you. Let me explain. Many of you know that I live in New York. If I purchased a home in 1994, and let's say I was age 37 and I was living on Long Island, I probably would have purchased the home in Nassau County. Why? Well, that's where most people live who work in the city and commute from Long Island. It's commutable. The other county is Suffolk County, by the way, and that's the Hamptons. There are a lot of very famous, very wealthy people who live there, but probably not appropriate for this discussion. And just for completeness, there are technically 2 other counties. There's Kings County, which is Brooklyn, and Queens County, which is Queens, both part of New York City. But most people don't think about Long Island when they think about Queens or Brooklyn. So anyway, it's 1994, age 37 years old. The average home in Nassau County was $175,000 in 1994. That's the average price of a home. Now let's say I put 20% down and I finance the home over 30 years. In 30 years, I would be age 67 and it would be 2024. And the home would be paid off. The average home price in 2024 in Nassau County was $789,000. So if I sold my $175,000 home in 2024, I would have sold it for $789,000. That would have been $614,000 profit on the home. And the rest is $175,000. That's how you get to $789,000. That's simply the price that I paid for the home. That's called the basis. Now it's January 2026, and it's time to make my healthcare payments. I have to pay for Medicare Part A, Medicare Part B, a Medicare Part D plan, which is a drug plan, a Medigap plan, or a Medicare Advantage plan. My payment for Medicare Part A, which is the same as most people, is 0. Why? Because I paid for Medicare Part A with payroll taxes when I was working. And as long as I had 10 years of work history, 40 quarters of earnings, there is no cost for Medicare Part A. Medicare Part A pays for things like hospital visits and anything hospital related. Then there's Medicare Part B that covers medical costs. Then I have to pay for a Part D plan, that's drug coverage, and a Medigap plan, or a Medicare Advantage plan, which usually includes drugs. We'll talk about drug coverage in just a moment. And let's say, like a lot of people, I have my Medicare Part B premium deducted directly from my Social Security payment. And the average Social Security payment in 2026 is projected to be $2,071. So let's just say that that's what my payment is. but I have to take off $202.90 to come up with my net number after the Medicare Part B payment. That leaves me with $1,868.10 after Medicare Part B. But something weird happened. My Social Security payment is direct deposited the second Wednesday of every month, and because of this, I have my bills set up to pay the second Thursday of every month. Automatically, they get paid. But Friday morning, something happens, and I get an overdraft notice from my bank. Now, as an accountant, I'm pretty good with numbers, so I'm not happy that I missed something. Plus, there's an additional $25 overdraft fee. In this situation that I'm discussing with you, I would have assumed probably that I just missed a bill and it went out and I didn't account for it. But I would have been incorrect. What really happened is my Social Security payment was much, much lower. It wasn't $1,868.10, it was $1,381.10, $487 less than I was expecting. And using this fact pattern, this example, I'm going to explain to you what happened next because it could happen to you. Gang, 2025 was a bad year for Medicare. Part B premiums went up 9.7%. 1.2 million people lost their coverage. Another very large group had significant premium increases, and still another group had their doctors and hospitals change on them. Between now and December 7th, we are in the annual enrollment period. That means that you have until December 7th to get on the right coverage for 2026. On this channel, we have only 3 affiliate relationships. One is our trusted Medicare partner, Chapter. Chapter is the only Medicare advisor that looks at every plan nationwide to see if you have the right coverage. If you do, they'll tell you. If not, they'll help you switch. They're totally free to you. They save their clients an average of $1,100 per year, and it takes about 20 minutes to check to see if you're on the right plan. If this is of interest to you, give them a call at 440-703-1224 to see if they can help. So what happened? Well, in this example that I'm giving you, the 2024 modified adjusted gross income was very large. And it's very easy when you have a one-time sale of a home to think that that has nothing to do with how much you actually earn. And it doesn't affect something like your Medicare Part B premium. But the sale of a home significantly increases your modified adjusted gross income of 2024, and your Part B premium goes up if your modified adjusted gross income goes up from 2 years ago. This surcharge is what's called IRMAA, Income-Related Monthly Adjustment Amount. In this example, it's an increase in my Medicare premium because I earn too much. But unlike, say, income taxes, where if I earn too much in 2025, I file a tax return in 2026, the IRMAA charges go back 2 years. So anything that I earned in 2024 gets recognized in your Medicare Part B premium in 2026. Now, many people think that this is quite arbitrary. Why isn't it 3? Why isn't it 1? Well, the fact is, if they treated IRMAA increases like taxes, what would happen is the following. You would earn your earnings in 2025, and you wouldn't be able to report those until April of 2026. But your increase should have started in January of 2026. So they actually need the extra year to make sure that they get the numbers right. But your IRMAA increase is entirely about your modified adjusted gross income. What is modified adjusted gross income? It's defined as adjusted gross income plus tax-exempt interest income. And what's counted in adjusted gross income? Wages, taxable Social Security benefits, traditional IRA withdrawals, 401k, 403b, and TSP withdrawals, dividends, interest, rental income, business income, unemployment income, pensions, annuities, and capital gains. Now, let's just say in this example, I had $68,100 in income and $614,000 in capital gains. So my modified adjusted gross income for 2024 is $682,100. Because it was so large, I definitely would have faced an IRMAA surcharge. Now, let's say I was single. IRMAA surcharges for 2026, which are based on 2024 modified adjusted gross income, look like this. For the IRMAA Part B adjustment for 2026, if my modified adjusted gross income was between $0 and $109,000, there is no surcharge. I just pay the $202.90. Greater than $109,000 up to $137,000, the surcharge is $81.20. Greater than $137,000 up to $171,000, the surcharge is $202.90. Greater than $171,000 up to $205,000, the surcharge is $324.60. Greater than $205,000 but less than $500,000, the surcharge is $446.30. And $500,000 or more, my Medicare Part B surcharge is $487 per month, giving me a total monthly payment of $689.90. That is $5,844 more than I would have had to pay if I had not sold my house. Now, what if I was married, filing jointly, and instead of making $68,100 per year, I made $68,100 per year, and my spouse made $68,100 per year. And we still had that $614,000 capital gains on that house. Well, together, that 1 year, we would have made $750,200, and we would have owed a lot of money in IRMAA surcharges. Let me explain. Married filing jointly, if our modified adjusted gross income in 2024 was between $0 and $218,000, we each would have paid $202.90, no IRMAA surcharge. Greater than $218,000 up to $274,000, we would have had an $81.20 IRMAA surcharge. Over $274,000 up to $342,000, the IRMAA surcharge would be $202.90 each. Greater than $342,000 up to $410,000, the IRMAA surcharge would have been $324.60 each. Greater than $410,000 but less than $750,000, the IRMAA surcharge would have been $446.30 each. And greater than $750,000, our IRMAA surcharge would have been $487 per month each. So I would have paid an additional $5,844 in IRMAA surcharges, and my spouse would have paid an additional $5,844 in IRMAA surcharges. That's a total of $11,688 more in 2026 in Part B premium. Now at this point, you've got to be thinking, could this get any worse? Yes, it could get worse, because we still haven't come to Medicare Part D surcharges. That's the drug plan. I've got a question for you. How prepared are you for retirement? Well, for a lot of people, the answer is, I have no idea. If that's the case, take our free quiz to find out. The quiz takes 2 minutes, it's 15 questions, and a 12-page report, totally free, will be sent to you as my gift to you. If this is of interest to you, go to holyschmidt.com/quiz, take the quiz, and see the results instantly. And by the way, when someone signs up for Medicare Part D, the cost could be $0 or it could be a substantial number. It depends on something called the formulary. The formulary is what drugs the Part D plan covers. Atorvastatin, lisinopril, metformin, all of the above, none of the above, some of the above. It depends on exactly what is covered on that plan. In 2025, there were 464 different options. Some cost $0, some cost a little, some cost a lot, but they were all subject to a Medicare Part D surcharge. This is what the surcharge looks like for someone who's single going into 2026. Same modified adjusted gross income levels. 0 to 109,000, no surcharge. 109 to 137, $14.50. 137 to 171, $37.50. Greater than 171,000 up to 205,000, $60.40. Greater than 205,000 but less than 500,000, $83.30. And 500,000 and above, $91 per month. Given the levels we were talking about, the surcharge would have been $91 per month or $1,092 per year, on top of the Part B surcharge. And this is what it looks like for a couple that's married filing jointly. Same levels, and you can see the premiums. I'm not going to go through them all, but just know that someone who's single who reaches the maximum surcharge pays an extra $1,092 per year. A couple that reaches their maximum Part D surcharge pays double that, $2,184 per year. So if nothing's done to reduce this, a single person could pay an additional $5,844 plus $1,092 per year, and if you're married, that doubles to $13,872. Now, just a couple of points here. I used examples for single and married filing jointly. There are also categories such as married filing separately and head of household. They're just not that prevalent. The second is that we haven't talked about Medicare Advantage plans, which include drugs most of the time anyway as part of the plan. There is no Part D coverage on most Medicare Advantage plans. Now, what happens if you have a Medicare Advantage plan? Do you still pay this Part D surcharge? Yes, you do. Also, you would still be required to pay for Medicare Part B premiums and surcharges, whether you had a Medigap plan, a Medicare Advantage plan, or just original Medicare. Now, a lot of people are saying my house hasn't gone up that much in value, therefore these numbers, they're very large numbers, but they don't apply to me. That's true. I will say that if you live on the coasts, East Coast, West Coast, you're more prone to have a bigger home value because they just cost more, generally speaking, in places like New York and California. That's not always the case, but often it's the case. Also, some areas throughout the country have had rising home prices faster than others. Others have had situations where prices have gone down recently. Others have had situations where things have gone way up recently because of lack of inventory. There's a lot of variability in the short term when it comes to home prices. Also, if you're not planning on selling your home for another 5 or 10 years, you really just don't know what the future looks like. But the point isn't that you're going to have these maximum penalties. The point is that there are going to be penalties more than likely if you have a big gain on the sale of your home. But it could be somewhere in the middle. Maybe it could be half. If it was half, it would still be a lot. Or maybe it'd be a third or two-thirds, who knows? But any of those numbers are big numbers when it comes to your own bottom line. So it's important to figure out how to reduce this if you can. Fortunately, you can reduce up to $250,000 of that gain from your modified adjusted gross income if you're single, and up to $500,000 if you're married, filing jointly, if you follow some very specific rules. Circumstance number one is that this needs to be your primary residence. It can't be rental real estate. If you own 2 or 3 rental properties and you have a gain on the sale of those properties, that doesn't apply here. As a primary resident, you need to have owned the home for 2 of the last 5 years. Now, practically speaking, people don't own a home in year 2 and in year 4. They own the home probably for the last 2 years before they sell it, if they comply with this rule. If you're married filing jointly, then either partner can own the home outright. The other one doesn't need to be on the title, and you can both benefit from this exception. Next, you need to have lived in the home for 2 of the last 5 years. Now, this one is a little more common a problem than you would think. Some people move when they're working. If you're in the military, this happens quite frequently. But if you lived in your home, say 4 years ago, and you moved out for 2 years, you rented it out for 2 years, and then you moved back in last year for the last year of the house, and you've had 2 years out of the 5, you comply with this provision. If you're married filing jointly, both spouses needs to comply with this test. The next point is that you can't have used this provision on another home in the last 2 years, and if you're married filing jointly, neither spouse could have used this provision on another home in the last 2 years. Now, here's how you bring that gain down even further. You increase the size of the basis. Remember, I said the purchase price was $175,000. But if you make any big capital expenditures and you apply these towards your home, then your basis goes up. A new roof, a new HVAC system. You put in water sprinklers on the lawn. I don't know. But the list is pretty significant. It's something that's long-term, and it's something that isn't considered maintenance. When you add these on to the basis, your capital gain becomes lower because the basis becomes higher. As a reminder, if you have questions about Medicare, give our partner at Chapter a call, 440-703-1224. Also, if you like this video, check out that video, why your 2026 cost of living adjustment just feels wrong. This is Geoff Schmidt, and I will see you in that video right there.